So, Kalpana Patel, thank you very much for taking the time. First, can you tell me how you met Bill Rea?
When I was attending the courses for American Academy of Environmental Medicine to get my basic education in environmental medicine, Bill Rea was one of the speakers that interested me the most, as his level of science knowledge, the basic knowledge of the science, was what I was looking for. Because I have always excelled in my studies, in understandings of the subjects that I learn. And so Doris Rapp introduced me to the American Academy of Environmental Medicine, and then Dr. Rea was one of the mentors, and then I got him under my wings, and then it just was take off from there. And we reached to, I think, really to the greatest height that we can, and I wish he was alive for a few more years, that we could have done some more things. But after his passing away, in my life some vacuum was created, because we were quite communicating for almost on a few times a week basis, and exchanging our patients, our problems. And as a friend, we were discussing also our families together, and it was such a kind support. More than a colleague, he was a friend. And so it's a great loss. But I'm just trying to occupy my time by entering into another new specialty of regenerative medicine. And
Regenerative.
yes, where the fixed name disease occurs, the environmental medicine does not have many tools to reverse. Environmental medicine can help from during the progression of the disease process to dyshomeostasis. But when the dyshomeostasis becomes a fixed name disease, then it is very hard to completely reverse the problem. And regenerative medicine is another tool in my box now I have, that I can make my patient better, faster, and these are more complex patients.
How are the treatments different, and for which diseases?
Well, we are using the regeneration through the stem cells, and so that is the innate nature of our body to grow, and every part of the connective tissue wherever there is a blood vessel, there is a stem cell. But all the stem cells are not active all the time. So the treatment that we provide is like we inject the stem cells, and they act like a Navy cells. And the Navy cells are introduced in the body, and then they instruct the body.
You say like Navy cells?
Navy cells.
What's a
like
Navy cell?
The Navy SEALs are the super special agent that go and in the new project. When there was a United States they had a project to find a Bin Laden. What did they do? They sent the Navy SEALs.
Okay,
and
the SEALs.
They just landed, and they just did whatever they had to do. And then the bigger troops just came around and helped. In the similar way, the stem cells we introduce, we don't think that they multiply and grow, but they are having the enough tools with them that they finish the job what they have to do, and then they call upon the body's own stem cells to come and do the rest of the job and continue to maintain the integrity of that.
And that would be for diseases like cancer?
That is for the diseases like osteoarthritis of the joints. Because as you heard, that when you put the metal in the joints, it becomes the antenna for the susceptible patients, and they become more electrosensitive.
Dr. Rea told me.
EMF sensitive.
Dr. Rea told me he was coupable. He put in so many implants himself that he was part of the problem.
That's right. So I got into that because my own husband needed a surgery because he was bone on bone in his joints. He has a family history of early development of osteoarthritis. His mother suffered from it, and his two sisters also suffered from it. And they already have the knee transplant. My husband was the oldest, but he was in a better condition than any one of them because of my approach of environmental medicine. However, that genetic bomb I was talking about does have an effect, and that when it explodes, you have to have the other venues what to do next. And that is the time we decided what to do next. And his surgeon told him that you have a full flexibility of your joint correctly. Motility is normal, but you will lose all of them or most of them. So when he told me this statement, then I said, we should really look for something more, something somewhere else. And simultaneously, at the same time, I came across a lecture given by a doctor who was doing the stem cells. And so I said, I will call him and we visit him. And I called the doctor and we visited him. And it was really a turning point in my life because I entered into the new specialty. Because that doctor knew who I was. So he said, you know what? You are going to do everything what I was going to do. I'm going to teach you and you are going to do, because he's going to require 2 or 3 more of the same treatment. And so when you go home, you will feel comfortable. So I did give him the treatment under his supervision. And then I came home and stem cells were delivered to my office. And we did the 3 treatments after that. And he has to do the exercise every day, but he's normal with full flexibility. And
when did you do it?
It was almost a year ago.
Okay.
And one more important thing, my husband said, you know what? After these stem cells, I think my brain is in a better mode because my networking has improved.
Wow.
Okay, and to I have him say that to me, that his networking is improved. It was a really surprise for me because he's a man of few words. So when he noticed that, I said, okay. So
it's a bonus, a great side effect.
Right. It was a bonus. It was a bonus.
I'm intrigued. You mentioned alcohol and electrosensitivity.
Yes.
Even is sauerkraut bad? You mentioned all fermented foods.
Yes, sauerkraut is good for normal healthy gut. But when you have a damaged gut, damaged receptors, it does not process the things the way it should.
Okay.
And I have a patient, and when I say that, you are not supposed to have this, and this, she said, "Doctor, you are so right, because sauerkraut just made me so sick." And I said, "Did it take you 4 days to get better?" And she said, "Yeah." "How did you know that?" I said, "Usually it takes about minimum of 4 days to get out of your system."
I have problems with alcohol, but I love sauerkraut. I'm taking it because I heard it's good, but I'll do the test.
Yeah. It's an individual susceptibility again. If you don't have damaged gut, and your microbiome and that microbiome, because every organism has their own microbiome, so your microbiome and their microbiome does have a good interaction, it will take you to new heights and feeling better.
Yeah, I've had backaches for 40 years, and I discovered it was digestion and foods, so I'm careful with foods, but I think my gut is better, but...
the food sensitivity sometimes just does not disappear. It gets better, but it does not disappear. And there are some specific, and that's what we call the specific load. It is that when you have the specific food triggering the specific symptoms, then you need to address that. And we have a very good success rate for making our patients better. But of course, they have to go through the skin testing.
Can you describe that, provocation?
Okay. So what we do is we have...
It's called provocation-neutralisation.
Right. Provocation is the diagnostic, and neutralization is the treatment. So with the one technique, which has two parts to it, and it does two different things. One diagnosis, one treats, and that's wonderful.
Who invented that again?
This was done by the Lee Miller technique. Lee Miller technique. And so Dr. Lee, I think he was an ENT surgeon, and Dr. Miller was an allergist. And Dr. Lee described that, and Dr. Miller modified and fine-tuned it.
And that was several decades ago?
Yes, of course.
In the 70s?
Yes, it was even before 70s.
And it's not well known today by physicians?
It was really promoted by the American Academy of Environmental Medicine. But as with the change of time, people were, the insurance company does not pay for the procedures.
How much
and
does
the
it
treatment
cost?
Related to it.
Typically?
It just varies from patient to patient. It can be from few $100s to few $1,000s.
Okay. So what do you do?
It's not for one thing, but it's multiple foods.
Yeah. What do you do? You're testing foods. You scratch the skin.
No, we don't scratch the skin. We make the food vial with the concentrate. We make 1 to 5 dilutions, and we call concentrate vial 1, dilution 1, dilution 2, dilution 3, 4. But each one is 5 times more diluted.
In saline?
In saline, and no
Saline.
preservatives.
Okay. And you inject it.
And it is intradermal injection. So it is also being practiced by the conventional allergist, but not in the similar fashion, or not looking for it. They just are using that to find if patient is allergic to not. And then if they find that patient is allergic, then they make the dilutions, and everybody is treated the same way. When we do the testing, we not only find out what patient is allergic to, but we find out the dose that relieves the symptoms. So it may require 2 or 3 injections. We find out what dose is the right dose for the patient that helps to relieve the symptoms. So we call the maximum tolerated dose or the symptom relieving dose.
It's not the dose makes the poison.
That's right.
It's the dose makes the cure.
Right, dose makes the cure, right. And so when you treat them with that, patient is empowered patient can do the shot themselves. If somebody has eaten A, B, or C food, and then they are reacting, immediately they know this is the food causing, and they can go and take the shot, and they are relieved of their symptoms. And as I told, that we do have the patients, we give them the neurotransmitters, also as antigen injection. We give them the trisols, and they give them the buffered vitamin C powder. Between all that, patient can really be free of symptoms without drugs.
And trisols are sodium, magnesium?
The trisols are the bicarbonate salts of the calcium, magnesium, and sodium.
Okay.
And there are some patients unable to tolerate, then there are compounding pharmacists make the special for them, the potassium bicarbonate, because there are some patients who have heart issues or blood pressure and they don't want to take sodium, then potassium can be supplemented.
It's always patient specific. I heard a mother tell me her teenage son, just with sodium bicarbonate, his electrosensitivity disappeared.
Yes.
So he wasn't too damaged.
You remember what did I say in my lecture? That there is something called vanilloid or capsaicin receptors.
Yes.
And these vanilloid or capsaicin receptors can be downregulated by giving.
Meaning downregulated?
Downregulated means they can be dampened. They can be dampened by giving the bicarbonate salts.
They don't react as much.
So then the allergic symptoms or the sensitive symptoms which are triggered by that particular system are completely gone because you are taking care of that particular system. Similarly, we give them the capsaicin neutralizing dose.
Dr. Rea told me that was part of the treatment.
Yeah, and when we do the capsaicin neutralizing dose, then they are much better. We have done the capsaicin neutralization. We have done, like, some patients have norepinephrine problem because of their methylation defects. Then we neutralize their norepinephrine. We had a patient with a mold sensitivity who had a cardiac arrhythmias from mold, and we neutralized him for mold and a capsaicin, and his cardiac arrhythmias were controlled.
Control for
without
how long?
Medication.
Do you need treatments every 6 months or typically?
If patient continues to reduce his total body burden of the pollutants, then the endpoints remains quite stable. But when you go into the more polluted environment, or you go and have a Fitbit on your wrist, or you go and wear the Bluetooth, you are increasing your total load. So then the endpoint or the tolerating dose or the symptom relieving dose is going to change, because you are producing a turbulence in your body. And we are producing turbulence in your body, then body just doesn't settle.
Humans are stubborn. Dr. Rea told me he treated a woman 25 years apart. She was great after treatment, and she came back nearly dying. And he told me she got cocky. She went back to her old toxic lifestyle.
Right. And that's what happened with the case number 2 I presented today. That when he started feeling better, he started again drinking alcohol with his friends, and then he even didn't tell me that he started getting Bluetooth for his wearing on his ears, and then Fitbit on his. So if the patient does not give you the enough information, you can have a failure on your hand, but you don't stop there. No. You really have to keep on inquiring. What else did you do? I think there is something is making you worse, and so we told him to get rid of his Wi-Fi and get rid of his check for the dirty electricity, turn off the light, the Wi-Fi at night, and take magnesium, so have a good night's sleep, do the yoga, do exercise, do meditation, so you bring down your sympathetic load.
Right.
And so these are all the prongs of the treatment, but it is not the main turning point. And sometime by just doing one thing, you are not going to make patient better. They may have to do 10 things, all 10 things simultaneously. And that's the most important message I wanted to give. That
You can't negotiate the treatment, Lisa Nash
That's
said.
That's right.
You can't pick in the
No,
list.
you have to clap with 2 hands.
That's good. Are you in touch with Canadian doctors like Rena Bray and Jenny Armstrong?
Yeah, sure.
Have you
Yeah,
given
they're nice
trainings?
people.
You should teach in Toronto, in Ottawa.
I think that would be good, but I think they think they know everything.
No, I'm talking about allopathic
You mean-
standard doctors. You should
But I
train
think
Canadian.
Jennifer does the environmental medicine.
No,
She's
but-
a board certified environmental
Of course.
specialist.
But
But Rena Bray is not.
she's not board certified in environmental medicine?
Yeah,
Okay.
she's not.
Lynn Marshall is?
No.
Oh, okay.
But Jenny is.
Okay, yeah. But I was thinking you should be in the medical faculties in Toronto, Ottawa, Montreal, teaching.
You know, when it's supposed to happen, it will happen.
I dream of that. Many people dream of that.
Yeah. You know, we try to reach too many by writing books.
You tried reaching too many.
Okay.
Well, you succeeded, I'm sure. Yeah.
Well, we worked 18 years, and as I said that initially we were writing by hand and going through the postal service. Every week I used to get my package, he used to get his package.
Bill.
Yeah, and Bill, until the last day, he never touched computer. He would send on my computer, and then I would send my corrections, my writings to the lady who was helping us out.
Mm-hmm. Are you still active with the American Academy?
Whenever it is essential, I do it.
Yeah. There's a new generation taking the flame.
Yeah,
carrying
and you
the
know, the river always doesn't maintain the same path. Sometimes the different forces turn the path of the river, and similarly, every organization has similar changes.
Mm-hmm.
But right now, I'm very happy about what I'm doing and incorporating the environmental medicine and regenerative medicine together, and making the hopeless patient, the patients, those who did not have a hope of getting better, they are getting better.
Wonderful. Well, congratulations, and thank you
you.
very much for your time.
Welcome.
You're beautiful.
Thank